If you're relying on allergy medicines either a lot of the year or if you have seasonal symptoms, then you really should get allergy tested. All right. So allergy testing is when we literally take allergens, like this is cat dander, okay, and we inject them under the skin and see if your body is reacting to that particular allergen. So there's many allergens that we can test for, and depending which allergist you see, they have a panel that they'll do. So dust and dander and pollens, molds, things like that. The reason we do that is not because we're not sure if you have allergy, but it's to determine what things are giving you those symptoms. We give you the things that you react positive to on a testing in tiny quantities, relatively speaking, okay, over a long period of time. And over that time, it's going to reprogram your immune system to not react to the things you're reacting to. So you can get off all the drugs, or at least decrease your dependence upon them. So if you're a 10 out of 10 allergy sufferer, like you have rip-roaring horrible allergies, immunotherapy is not likely going to make you have no allergy symptoms. But it may turn it way down, like a 2 or a 3 out of 10. Okay? And if you're a moderate allergy sufferer, you can be cured from allergies. So there's testing by under the skin, that's called intradermal testing. There's a prick test version, that's a kind of a shorthand version of the intradermal. And there's blood testing you can do, okay? So normally if you're blood testing somebody, it's a blood draw as opposed to poking them a bunch of times. But most allergists, if whatever's negative on that blood test, they're gonna test you with the intradermal anyway. Having an allergy test is kind of like having a TB test. It takes about an hour. So once we have those results, then we can create a specific prescription for your immunotherapy, and then there's 2 ways to deliver the immunotherapy to you. So we have shots, and there's something called allergy drops, or more technically it's called sublingual immunotherapy. All right, so the difference is they both do the same thing. They're both trying to reprogram your immune system away from allergy. The shots are done under the skin, and the drops are done under the tongue. Big difference is most doctors won't let patients get themselves shots at home. A few do, but most people have to go to the doctor because when you have a shot, you can develop an anaphylactic reaction, which requires medical attention. Drops don't really cause anaphylactic reactions, so they're safe for home use. So you do them daily at home versus shots are usually once or twice a week, at least in the beginning, and then they usually space out the shot. So it doesn't matter which one you do, just the biggest thing to remember is people that treat allergy are the ones that have to test you. So you can't go to Dr. A and get testing and then go to Dr. B for treatment. All right, so you should decide if I were positive and if I were a candidate for immunotherapy, would I want to do drops or would I want to do shots? And then go to a doctor that offers those options.